The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Well, hi, I'm Kathy. As your host each month, we focus on different areas of getting older. My first program outlined the 10 domains of purpose-driven aging. In each month, we dive deeper into aspects of each of these 10 domains. Today's show focuses on the insurance domain, specifically unpacking Medicare, and how to avoid costly mistakes. So let's dive in. Think of the Medicare program as your basic insurance plan in retirement. While Medicare will cover much of what you need, it doesn't cover everything. This is where supplement or Medigap insurance comes in. I worked as a Medicare Shine counselor for years, and I guided people in using their Medicare benefit as a small business owner, and today I continue to help people with the realities of this changing benefit. Today, we'll look at critical choices you need to make to avoid the main pitfalls. First, a brief overview of the Medicare program. The differences between original Medicare and Medicare Advantage, and they are significant. The top 5 mistakes that most people make or have made, and then we'll close it up with local resources here and in communities. So let's look at the Medicare programs, Medicare at a glance. It was originally established in 1965 by then President Johnson. It was an amendment to the Social Security Act and remains a crucial program for health insurance today for Americans aged 65 and older, and for certain younger individuals with disabilities. It was originally aimed at reducing healthcare costs for older people. Medicare has since expanded to cover a wide array of services, including hospital care, outpatient services, and prescription drugs. The original Medicare program began with just 2 parts, Part A for inpatient hospital care, and Part B for outpatient or physician care. In 2006, the Medicare Part D prescription drug plan became law. These are the 3 parts of Medicare, as you see on the graphic here, Medicare at a glance. A, B, and D are the parts. In 1997, the Medicare Choice Program came into being. It's erroneously called Part C. It's not a part. It's a separate plan, as you see in the graphic. It was introduced under the Balanced Budget Act, allowing private insurers to offer Medicare-approved plans that include all the benefits of A and B. You have to have A and B before you can join a Medicare Advantage plan, and often with other services like vision, dental, and drug coverage. In 2003, it was later named Medicare Advantage. Now, Medicare Advantage operates through managed care frameworks like HMO, Health Maintenance Organization, and PPO, Preferred Provider Organizations. Medicare Advantage has become popular for its additional benefits and potential cost savings. However, there are significant differences between the 2 programs. And during the annual enrollment program this fall, which starts October 15th, don't get caught up in the hype, the commercials, and stay aware of the differences because they are important. So what are these differences? So as you see on your screen, there are 2 choices, 2 paths, 2 distinct ways to receive your Medicare benefits, each with different features, coverage, options, and costs. Both options consist of Part A, which covers, again, hospital care, home health care, and other acute care services. Part B covers doctor's visits, outpatient services, testing, medical equipment, and some preventative care. But each one does so in different ways. So beneficiaries who elect original Medicare can visit any healthcare provider or hospital that accepts Medicare. There's no need for referrals or prior authorizations. While Original Medicare offers flexibility in choosing providers, it does not include coverage for prescription drugs, or routine vision, or dental, or hearing. For each of these, you need to get a separate plan. So most people elect coverage through Medigap policies. And then you have to get a separate Part D plan for prescription drugs. We'll look at this a little more in a bit. Each of these parts, Part A, Part B, Part D, has different cost structures based on your income and health needs. You make decisions with your healthcare providers. Original Medicare is a fee-for-service program managed by the federal government. Beneficiaries in Medicare Advantage choose an alternative offered by private insurance companies approved by Medicare. It bundles all the benefits of A and B into a single plan. Okay? It has other coverage often like dental, vision, and hearing. Most Medicare Advantage plans also include prescription drug coverage, but the plan chooses your prescription drug coverage. This simplifies the process by combining everything into one plan. However, these plans have provider networks of doctors in hospitals, which limits options for you to choose providers. Medicare pays a capitated or fixed rate to the plans with referrals and prior authorization for certain services needed, which often can result in delays and denials. So, there's a brief difference between Medicare and Medicare Advantage. So know that Medicare isn't free. It has a series of premiums, deductibles, and co-payments that apply to all patients. The Centers for Medicare and Medicaid Services, CMS, update these costs every year to reflect inflation and the underlying costs of care. These exact amounts range based on choosing a Medicare plan Part A, Part B, and D, or choosing a Medicare Advantage plan that bundles. So let's take a closer look at this right now, a closer look at the options. Got to change out my glasses here so I can read. So, as you can see, there's a difference between choice, coverage, and cost, no matter which program you go with. So we're going to compare and contrast each program. So with choice, with Original Medicare, you can use any doctor or hospital that takes Medicare, anywhere in the United States. You don't need a referral to use a specialist or to go to another hospital or another program. Anyone who accepts Medicare, you have that choice. With Medicare Advantage plans under choice, you use doctors that are in that plan's network. In that plan's network that is in the service area of that plan. You often need to get referrals for specialists. So as you can see, the difference between the two with choice comes down to flexibility. You know, what you can do, what your physicians, what your other healthcare providers can do, and then again on the other side, what's dictated by the plan. So there are resources we're going to get into in a little bit about how you can get help with this and get more information. So what about coverage? Well, with Original Medicare, it's medically necessary services, supplies in hospitals, doctor's offices, or in other healthcare facilities and at home. It doesn't cover the benefits, again, like routine care, and it doesn't cover most dental care. Medical necessity is a very difficult term for people to get their arms around. You, as a customer, consumer, a patient, don't have to worry about it. It's us as providers, as doctors and nurses. We're the ones that have to document the medical necessity in the variety of levels of care according to the regulations or the insurance guidelines. So it's up to us. Medicare Advantage also requires medical necessity. Services that Original Medicare covers. It has to cover Part A and B. It may offer extra benefits and often does. The vision, the hearing, the dental. So with Original Medicare, you elect a separate drug plan. Part D. Each drug plan has formularies, which are which drugs are included, and tiers, which drugs sit on which cost tier. With Medicare Advantage, the drug plan is often rolled into it. It's chosen by your Medicare Advantage plan. It also has formularies and tiers. For coverage under Original Medicare, you and your doctor determine the best option. You don't need to get approval to cover your services. With Medicare Advantage, you need approval, often need approval, or prior authorization as it's known, or pre-authorization from your plan before it'll cover certain services, supplies, and medications. So there's the difference in coverage. Again, it's decisions made by you and your healthcare provider versus decisions often made by health plans. So what we're going to do now is we're going to shift down to costs, because that's where everyone really has an interest, right? I certainly do. So there are 4 different areas where costs come up. Number 1, premium. Number 2, deductibles. Number 3, cost sharing. And number 4, out-of-pocket maximum or yearly limits. Now this is pretty typical for insurance in general. If you're used to getting insurance from your employer, a lot of these terms may sound familiar. So let's look at premiums. With Original Medicare, most pay nothing for Part A. Part A is what you pay into through your FICA or your payroll tax. So that is set up by the government and is usually no cost for most people. Part B has a premium. It has a premium of $174.70 as of 2024. Now, there's word that that's going up to $185 for 2025, but nothing has been published yet. Part B premiums are also subject to modified adjusted gross income. So what is that? It's based on your income. So each tax year that has been completed, so for 2025, the most recent completed tax year is 2023. So you need to look at where, and you can find this information on Medicare.gov under Medicare cost, where you fall and what your Medicare premium would be. If you make more money, say, than $103, $105 per individual a year, then you're going to be subjected to paying more in premium. There's also a separate premium for Medicare Part D, drug coverage. On average this year, $55.50 a month. I hear it's going down to like $37 and some odd cents, but that is an average. Every plan sets its own. And remember, drug plans are private plans. With premiums with Medicare Advantage, the Part B is the same. It's still subject to the same income, the information we just discussed. Some plans may offer 0 premium. Some may have a low premium. Some plans adjust their premiums to be $10, $20, $30. Others can be $200, $300. So it's important to shop your plan. Most plans include the Medicare drug coverage within it. It bundles it, so there's not an extra premium. This is the one key thing to look for. Deductibles. Deductibles for Part A in 2024 dollars are $1,632 per hospital stay, known as the benefit period. Part B is $240 deductible, and the D plan is $445 deductible, and that's 2024 dollars. The numbers are just starting to come out now, so again, you can find them on Medicare.gov under Medicare cost. Deductibles under Medicare Advantage plans are a little bit different. The medical and prescription drug deductibles vary by plan, so again, you got to shop your plans. Separate amounts for in and out of networks, and separate amounts for different pharmacies you may use for Part D. Cost sharing. Cost sharing, remember Part B, no matter which plan you're in, pays 80%, so you're on the hook for 20%. So with Original Medicare, most people buy a Medigap policy or a supplemental policy that pays the additional 20% coinsurance as well as those Part A and Part B deductibles. You can also use coverage from a former employer, former union, or if you have VA coverage, or are on Medicaid. If there are different payers for your drugs that are credible, you can use those as well. So you'd need to check with your employer if you're aging into Medicare to find out if you can use it as a supplement. The cost sharing in Medicare Advantage looks a little different. Medicare Part B still only covers 80%, and most of the 20% is spread around through copays and coinsurances every time you visit a provider. Now, this is really felt for somebody who has a cancer diagnosis. I can tell you most Medicare Advantage plans have you pay 20% of all cancer. Now, having just gone through this with a family member over a couple of years, I can tell you that this was devastating when these costs start to come in, 20% of costs, because you cannot buy a Medigap policy with Medicare Advantage. The Part D program works the same as it does with original Medicare. So the biggest piece of the cost sharing is that most of the out-of-pocket expenses are done through copays and coinsurance. And finally, the annual limit or the maximum out-of-pocket. With original Medicare, there is no maximum out-of-pocket. However, if you have supplemental coverage, then that is a pretty good deal. So you get 100%, almost 100% coverage after you meet your Part B deductible. And it's important to realize with the cost that they reset every January. So just because you've met your maximum or you have good coverage, know that these deductibles and everything else resets and changes. One of the biggest things that has changed for 2025 with the Part D is the out-of-pocket expenses are going to be capped at $2,000 and the donut hole goes away. So for those of you who know what I'm talking about, you've probably been burnt in this area. So there's no yearly limit, but with original Medicare and a supplement, you have pretty good coverage and adding a drug plan that is now going to be capped. With Medicare Advantage, there are out-of-pocket expenses, but once you reach their maximum, which varies by plan, then you pay nothing for the rest of the year. So in 2024, the maximum out-of-pocket cannot exceed, say, $8,850. I heard that's going up to $9,000 in 2025, but again, nothing's published. And for in-network and out-of-network combined, it goes up to $13,300. Now, many plans set that maximum out-of-pocket lower. So this is why it's important to shop. And also with Medicare Advantage, you're going to see that drugs in Medicare Advantage are also capped at $2,000. So that essentially is a closer look at the options. So what I want to do is just jump into now the 5 mistakes that most people make when they're choosing a Medicare plan. So navigating this program, as you can well imagine, can be challenging, and there are several common mistakes that people make when enrolling and or using their benefits. So we're going to take a closer look at 5 of them. So we just went through choosing the right plan. Okay, I don't want to bemoan this one, but learn and know the differences between original Medicare and Medicare Advantage, as well as the different options with Medicare Advantage plans. Compare the plans that meet your own healthcare needs and your financial ability. Do not choose based on your friend's plan or your spouse's plan. I've seen people do that and they get into trouble. If you have many active medical problems, you're seeing many physicians in and out of the hospital, Medicare Advantage may not be the best fit. Check the Part D plan with its formulary and which tier your medications are on. We'll talk about in a minute. You can use the Medicare.gov website or make an appointment with a local Shine counselor. In Easton, they're at the Council on Aging and they're available year-round. They're also available in every community, and it's a free service for you. The second mistake, missing enrollment periods, because they come with penalties if you do. If you miss key enrollment deadlines, you face penalty and or experience gaps in coverage. It's important to know these enrollment periods. The initial one is when you turn 65, 3 months before, 3 months after. The general enrollment period runs every year between January and March. If you were to miss something, this is kind of your catch-up. And the special enrollment period for people who continue to work past there and retire later. And there are rules for each one. To avoid these issues, you need to understand the enrollment without penalties. Again, check the Medicare Gov website or make an appointment with a Shine counselor, because this is complex stuff and it's complicated. It's not easy to navigate. Another mistake people make is ignoring getting supplemental coverage. Remember, traditional Medicare, Part A and B, they don't cover all the expenses, the co-payments, the deductibles, and the other services like dental and vision. Overlooking the supplemental coverage, such as Medigap plans, leaves you with high out-of-pocket cost. Massachusetts has guaranteed issue policies. That means that you can't be denied because of pre-existing condition. And it also has open enrollment for plans. That means you can buy anytime. Other states are not so fortunate. We're the only one in New England. The fourth one, as we've talked about, is overlooking prescription drug coverage. Just because I don't take any drugs when I start Medicare doesn't mean you can't get a prescription drug plan, and you should get one. Again, they're private plans approved by Medicare, and the two ways you get them is a standalone plan that you get with Original, you have to enroll, and the one that's wrapped in the Medicare Advantage Part D benefits. Now, we talked about formularies, list of covered drugs, and we talked about tiers. So the formulary is what drugs, are my drugs, do they have them? Will they pay for them? And then again, what tier is the drug on? So the tier 1 drugs are the low cost. Tier 2 drugs include preferred brand name drugs. Tier 3, 4, and 5 are the more expensive. They have the higher copay, the highest coinsurance. Now, reviewing your plan's formulary, or any plan's formulary, during the annual open enrollment, which again starts October 15th, is crucial because changes can impact your cost and your access. If you have your meds through the VA, TRICARE, or the Federal Employee Health Bureau or benefits, there may be difference. Your employer may cover. You may not need to purchase, but you need to check it out because you have to have drug coverage. You have to have that. So check with your plan, check with your employer, check with your union, check, and to be sure that you know what you need to do if you're aging in. Your Shine counselor is also a great resource. And finally, not reviewing coverage each year. Again, it's vital to reassess coverage. Even if you're happy with what you have, they may change on you. Now, open enrollment starts October 15th and runs through December 7th. And any changes you make are effective January 1st. Each year, there are changes in drug formularies, provider networks, and coverage options that affect both cost and quality of care. Additionally, plans can alter their premiums, their deductibles, their cost-sharing requirements, and new plans and new benefits become available. So in September, or by the end of September, you'll receive an annual notice of coverage from your Part D plan and your Medicare Advantage plan, or your Medicare Advantage plan. It provides information and changes to your coverage in the upcoming year. It is sent to you, again, by the end of September. Now, there are 3 changes to look for in your plan's coverage. So the first change that you're going to look for are changes in programs, changes in coverage, and you're going to look for changes in providers. Because oftentimes, and we're seeing this a lot, especially with Medicare Advantage plans, that physicians and hospitals are pulling out of networks. Pharmacies are pulling out of networks. So you need to make sure they're still in there. If not, you may need to make changes. You need to look at the formulary. Your drug may or may not be included, or it could be put on a higher tier. So it's important, again, with this annual notice of change, to review every year and shop your plans. So that, in essence, is what's going on with Medicare. So what I'd like to do now is just kind of spend some time going over the resources that are available in the community and how to use them. So we talked about local Shine counselors. Now, local Shine counselors are available in all communities. They're either offered through the Council on Aging, which exists in most communities, or through the what I call area agencies on aging, or places like Old Colony Elder Services, Bristol Elder Services. So if you make a call and try to get an appointment with a Shine counselor, that's your best bet. You can also go to a Medicare website, SHIP, S-H-I-P, help, HELP.org, and you can type in your zip code and it'll bring up a list of Shine resources that'll be available to you in your local community. And again, as I mentioned, in Easton, they are offered through the Council on Aging here. And it's a year-round service, and they ramp up pretty quickly starting in October with open enrollment. And again, this is it's a free service. Massachusetts also has a list of resources available on Medicare and also on Medicaid. We didn't talk about Medicaid today. Medicaid is a state program, income-driven. Medicare is an entitlement program based on age and ability. So mass.gov/topics/seniors provides a lot of information, as I mentioned, on these area agencies on aging, and they break them down by other benefits. Specifically, we're talking about Medicare or insurance here today, but it's a wonderful resource for you to tap into. Resources for comparison. If you go to medicare.gov, there's a lot of information there. The cost information I went through should be out for 2025 in September. Also, what the Part B premium will be and other premiums. The Medicare Advantage plan will have their information up and running. And for Part D, prescription drug programs, it's important to know what drugs you take. They have a wonderful tool on this website, easy to use. You put in your medications, and it'll also, in which pharmacy you use, and it'll bring up a whole list of different plans for you to choose from. What their premiums are, what their deductibles are, what their cost sharing would be. And it's important for you because we know that they change every year. I've been doing this a long time, and they change every single year. So this is something for you to do. If you have trouble, a Shine counselor can help you with this as well. And again, it's free of charge. And finally, I just want to issue kind of a cautionary tale here. When you Google or use any other kind of search engine looking for Medicaid, you're going to get millions of returns. Most of those initial returns tell you to call here, do this, click this link. These are ads. These are promotions by different companies. And you can get pulled in and locked into a plan that may not fit your needs. So find the Medicare.gov first, talk to a Shine counselor first, before you reach out and start talking to people that are selling you things. So I'd like to close by saying thank you for joining us today. This program, Purpose-Driven Aging, isn't just about getting older. It's about living each day with meaning, making a difference in the world. Today's episode, Unpacking Medicare and How to Avoid the Common Mistakes. I'm glad and I hope you got something out of it. We'll see you next month with another topic. Until then, take care and embrace your aging journey.